Hello, I'm Robert Gillespie, Chief of Shoulder and Elbow Surgery at the Sports Medicine Institute of University Hospitals, Ahuja Medical Center, and Cleveland Medical Center. At University Hospitals, we have a full array of board-certified, fellowship-trained orthopedic surgeons ready to care for your shoulder needs at many convenient locations throughout Northeast Ohio. In addition, our team of nurses, advanced practice providers, therapists, and integrative health providers will be with you every step of the way in order to help you back to all the activities you enjoy. If you do require shoulder replacement, University Hospitals Ahuja Medical Center recognizes that every patient is unique, so your care will be personalized by our expert team of providers using leading-edge surgical and therapeutic techniques to achieve the most successful outcome. In addition, we have a well-developed program to manage your pain after your procedure, allowing most patients to go home comfortably on the same day of surgery. Thank you for choosing University Hospitals Ahuja Medical Center for your shoulder needs.
On the day of surgery, we ask that you arrive 2 hours earlier than your surgical time so that we have plenty of time to insert the IV, conduct a preoperative evaluation, and complete any blocks or procedures needed prior to surgery. Sometimes the timing of surgery varies a little. We always want to keep you informed of a time change for your surgery, making sure you always know what to expect. If you ever have any questions or concerns about the timing of surgery or anything else, you can ask. Everyone is here to help you. The preoperative area is busy early in the morning when many surgery cases start. The area may be busy and noisy at this time, but we try to keep as quiet and respectful as possible. Please let us know if there's anything we can do to help. When you're brought into the preoperative area, you'll meet your pre-op nurse. Your nurse will verify all of your medical information and insert an IV. Once you've changed into a hospital gown and settled in the pre-op area, your family or friends will be able to sit with you. While you're in the pre-op area, you'll meet with your surgeon, who will verify your surgical procedure, make sure you have a consent form signed, and answer any questions you might have about your procedure or your recovery. You will also meet your anesthesia team, which consists of an anesthesiologist and an anesthetist. You'll discuss with them the type of anesthesia you'll be receiving that day. Often, shoulder or elbow surgery patients will need a nerve block to reduce post-operative pain. If a block is needed, your attending anesthesiologist will discuss this with you, give you sedation to make you comfortable, and perform the block in the pre-op area. You will also receive general anesthetics. All anesthesia decisions are made between the patient and the anesthesiologist on the day of surgery. Lastly, an operating nurse will come to the pre-op area to check you in for surgery. You'll be given some preoperative sedation to help relax you as you are taken to the operating room. A member of the anesthesia team and the operating room nurse will bring you to the operating room. Once in the operating room, you'll see people who are there to assist the surgeon. You will be assisted to move onto the operating room bed. We will monitor you to make sure you're safe with the anesthesia during your surgery. Your surgeon will come into the operating room, verify who you are, what the procedure is, and we will then use your IV to get you off to sleep and start surgery. Once you are medically stable, you will be taken to the orthopedic unit on the 7th floor. Many patients who have good pain control and the desire to leave on the same day as surgery will be brought to our transitional care unit, also on the 7th floor. There you will meet your orthopedic nurse, work with an occupational therapist, learn how to get your sling on and off, and get dressed. You'll be discharged home the same day if you and the team agree on this plan. Patients whose pain is not controlled, who are medically unstable, or are more comfortable staying overnight will be admitted and discharged the following day. Thank you for choosing Ahuja Medical Center for your orthopedic needs. We're committed to patient safety and great quality care. We look forward to meeting you and are excited to be your partner on your road to recovery.